Adrienne here, wanting to show you my favorite, or one of my favorite lower body routines that incorporates a lot of my favorite modalities and tools. So we're going to be working from the hips down today, and I have some options for you for the tools that you need. You don't need everything here, but I recommend a melt large soft ball or a ball that can completely compress under your weight. Don't use a ball that's firm like a lacrosse ball or anything hard. You're going to want something that can ease into the bottom of your foot where we're going to start. So a melt large soft ball would work. Secondly, you're going to need some sort of platform that we're going to use to help stretch our calves. So you can use a book with a rolled up towel. Either way, you want to maybe get 15 degrees off the ground. You don't want to be in a place where you're going to dorsiflex your foot so much, especially if that's painful or if you have ankle or hip instability or even knee pain. But a book with a rolled up towel works fine, or if you have a roller that can be flat on one side and rounded on the other. And then the last thing you'll need is some sort of vibration or percussion device. What I have here today is the Melt Fascia Hydrator, and I have the rapid release traveler version. I have the bigger one in here as well, so it's up to you. If you have a Theragun or if you have a hypervolt device, that's also appropriate. You have options here. So let's get started. We're going to start with a foot treatment with the large soft ball. So we're going to place that down for a second, and I just want us to check in and assess where we're at. So for our assessment, we're going to stand with our feet side by side. If you look down, your toes should be in a straight line, and your feet are going to be about hip width apart. So try not to stand too wide. You want to be equal footing here. And just kind of shake it out, the wiggles for a second, and then I want you to just stand as still and relaxed as possible, not mountain pose, we're not doing yoga. Just hands at the side. You can close your eyes if you want and just tune in, scan your body, see what you notice. See if there's anywhere that immediately calls your attention to being a point of tension. It might be your shoulders, might be your glutes, might be your thighs. But let's bring our awareness to our feet, and I want you to notice how much of your feet are covering the ground. You might feel like you lean more to the balls of your feet. Maybe you're standing back on your heels. Maybe the outer edge of the foot. Just notice what you feel. And then scan up the legs, up through the knees, thighs, up to the glutes. And if you notice that you're actively clenching any muscles, see if you can relax those muscles and soften your knees. So if your knees are locked, give them a slight bend. Soften if you're gripping at your thighs or your glutes, and see what that does as far as feeling grounded and touching the floor. And then the last thing I want you to notice is, how aware are you of your lower body? Do you live in your head all day? Do you feel like your shoulders cry out for attention more? So that's where your awareness goes. How aware are you of your lower body? Let's keep that question in mind. Go ahead and open your eyes. We're going to start with the foot treatment. So I'm going to start with the ball right in the middle of my foot. So what we're going to do is we're going to compress the ball in very specific areas of the foot. Cueing is going to be really important to pay attention to, but don't worry if you don't get it right. If you have the right ball and it compresses on your foot, this will be perfect. I'm going to just kind of hover my right foot, whatever foot you start on is up to you, over the ball. And if I turn to the side, you see I'm lining it up with the very center of my foot, so the arch of my foot. Okay, so I'm going to start kind of on my tippy toe here, and I'm just going to gently lean my weight down onto the ball, and then I'm just going to start to compress side to side. So soft bend in the knees, gentle compression on the ball. You want to stay within your tolerance. So if coming over onto the ball is too much for you because you have sensitivity on the bottom of your feet, don't put all your weight on the ball. It's okay not to. So we're compressing back and forth, kind of waking up the sensory receptors on the bottom of our foot. And then we're going to compress on this ball as much as is comfortable. And we're going to move around. Essentially, we're telling our brain where our joints are in space. Because our brain thinks we're on an unstable surface and that we might be falling, it's calibrating where all of our joints are at. This helps us maintain a nice straight line center of gravity when we're balanced. So we're going to step back the foot that doesn't have the ball. And now we're going to go underneath each knuckle of the toes. So I'm going to start with putting my big toe knuckle on top of the ball, and I'm going to lean forward. It's like a slight lunge. And if I look down, I shouldn't see that ball between my toes. So if you do see that ball between your toes, I want you to scoot your foot up a little bit so that ball moves back down. We're going to press one time underneath the big toe, lean back, slight move over of the foot. Now we're going to compress on the second toe. Exhale on the push. Come back off, scoot over to the third toe knuckle, lunge into it, press down, come off. Fourth toe knuckle, adjust your stance as needed, press down, come off. Fifth toe knuckle, look down, make sure that ball is not squeezing out from the side of your foot or between your toes, and then come off. I'm going to change my position so you can see where I'm going. Now I'm going to be on the inside arch of my foot, halfway between the big toe and the heel. I'm going to compress. So now the ball is actually on the inside edge of my foot. That's fine. I'm going to compress here, and then I'm going to lift off. I'm going to scoot that ball up. So again, just underneath the big toe knuckle, press down, come off. I'm going to turn the other way. Now this ball is going to be halfway between my pinky toe and the heel, right at the very edge. I'm going to compress, and I'm going to come off. And now the ball is going to be just where my heel starts to taper. So a little bit further back than the middle of your foot. I'm going to compress down. And if I had X-ray vision, I would see that that ball is right between my two ankle bones. That's essentially where you want it. I'm going to compress. We're going to go through that one more time. I'm not going to turn my body so you can actually just do it in real time with me. So come off the ball. We're starting over. I'm going right in the very middle of my foot, compressing down into a slight lunge. Come off. First toe knuckle, compressing down. Ball is not shown between the toes. Come off. Second toe, press down. Come off. I'm exhaling as I push down. Third toe. Fourth toe. Fifth toe. Adjust your stance as needed. Inside arch of the foot, halfway between the big toe and the heel on the very medial edge. Press down. Come off slightly. Roll your foot back. That ball goes up towards the big toe. Press down. Outside edge of the foot, halfway between the pinky toe and the heel. Press down. Come off. Now I'm going right between the ankle bones, slightly behind where we first started. Press down. Come off halfway. Come off 50%. So adjust your stance. The back foot can slide out a little bit so you have some balance. I have 50-50 weight distribution on my legs. Now I'm going to actually keep the ball of my foot on the ground. I'm going to swivel my heel back and forth. So in melt, we call this a glide. What we're doing is essentially exploring the tissue. We're seeing where we might have something that feels grainy, crunchy, sensitivities. We're also softening the plantar fascia, the really thick part of our feet that tend to be sore in the morning. So as I'm gliding, I'm scooting my foot forward so that ball actually travels back towards my heel. And once it's at my heel, I'm going to reverse, pulling my foot back in towards my body until I get to the last spot where I was, which is right between my ankle bones. And I'm going to just really quickly wiggle my foot on top of the ball. So this is a shear. So I'm pinning the tissue of my heel between the ball and the bone of my heel. So what it's doing, it's creating like a fluid effect, like a sponge. I'm squeezing all the fluid into the tissue, into the sponge. So when I stop and I pause and I let go of that, now all that fluid comes out to the margins of my feet and my foot's hydrated. Let's take that fluid that we just let out from all of around our foot and we're going to rinse it. So a rinse means we go in one direction. It's going to look like I'm skating over the ball. I'm going to do a slight compression. I'm going to push my foot over the ball and step completely over, come off, start again. Compress the ball, skate over it, come off. Again, you don't have to lift your back leg off the ground like I am. It's just what I like to do. Off. We're going to do two more. Doesn't matter what toe you're starting under. You just want to go from toe to heel. Okay? And then we're going to do the same thing on the other foot. Now that you kind of get the idea of what we're doing, we're going to go a little faster. So my other foot now is going to hover above the ball. I'm going to start with the ball right in the very middle of my foot. I'm going to compress down as much as is comfortable. Again, remember, if this is any bit of sensitive for you, you don't have to put your whole body weight on there. It takes time. It took time for me to get here, for me to be able to put all of my weight on the ball. And look at me now. Okay. On your next compression, we're going to stay with the ball compressed. Pause there. Go ahead and start moving your body around. Again, we're telling our brain that we're on an unstable surface because we're standing on an uneven surface, right? A dome surface of a ball. So our brain has to calibrate where are our joints to keep us nice and aligned with the center of gravity. We're going to go ahead. We're going to step back with the foot that doesn't have the ball. And we're going to go through all those compression points again. So I'm going to go underneath the big toe, lunge forward, come off. Second toe, come off. Third toe, come off. Fourth toe, come off. Last one. Fifth toe, again, don't worry about your balance. If you need to readjust, that's fine. Halfway between the big toe and the heel, medial arch, I'm going to press down. I'm turning sideways so you can see it. You don't have to turn like me. Then I'm going to scoop my heel back so that ball comes underneath that big toe knuckle. Again, press down. I'm going to turn so you can see this way between the pinky toe and the heel, outside edge of the foot, compress. And then I'm going to turn back to you, and this ball is going to go where my heel starts to taper. If I look down, it looks like it's right between my ankle bones. Okay, we're going to go through that one more time. Right in the center of the foot, compress, exhale. Under each toe knuckle, okay? So the good thing is that these points that we're doing underneath our toes, now moving to my third toe, correspond with reflexology. So these pressure points actually help out opening up our sinuses, helps out jaw tension, head tension, neck pain. Let's go to the inside arch of the foot. So I wouldn't be surprised if maybe you have a little bit of drainage or sinus clearing that might happen because of these points. Outside edge of the foot, halfway between the toe and the heel. And the last spot is right in front of the heel, between the ankle bones. Keeping the front of your foot on the ground, the forefoot on the ground. Let's start to swivel our foot, our heel back and forth. So we're gliding. If your hip doesn't have this much mobility, internally and externally rotating, don't worry about it. Okay. What you want to do is actually just keep your foot pressure consistent on the ball. Even if your movement is much smaller, that's fine. And you're going to slide your foot forward as you're gliding, exploring the tissue, noticing what's sensitive, what might feel grainy, and then coming back, pulling your foot back towards your body until that ball is between your ankle bones. Then you're going to make a nice, tight wiggle. This is our shear. We're pinning the tissue between the ball and the bone of our heel, and we're kind of working fluid into it like a sponge. And then we're going to pause, and then we lift off the ball, and all that fluid comes flushing out to the margins of our feet. Now let's rinse it. I'm going to turn to the side. Remember, compress the ball, skate over the ball, and come off. We only go one direction, so don't skate backwards over the ball with it on your foot. You want to go from just toe to heel. We're going to do two more, and then one more, and that's it. Now let's stimulate the bottom of our feet. Find your balance, tickle the ball in the bottom of your foot. This is just kind of helping move any excess fluid or anything else. We're going to stimulate the lymphatic channels at the bottom of the feet. Switch feet. Okay, and that's that. So kind of move that ball out of the way, shake it out, see where you're at. Maybe it feels like you have a nice fluid line from your ankles to your knees to your hips, right? Everything might feel more like one leg rather than noticing, oh, my right hip feels off, or oh, my left knee hurts, or oh, I'm standing more on my right foot. So this kind of helps wake up our limbs, our lower extremities, to wake up the sensory receptors and hydrate the fascia. Now we're going to do some active movement. We're going to stretch our calves. So whatever platform you're going to use, whether it's the half roller that has a flat side and a dome, that's fine. I like to use a book and a towel because I don't want to really flex my foot so hard where it hurts. I actually want to get some range of motion here. So you're going to place your foot so that the ball of your foot should be able to relax on whatever you're on, whatever surface you're on. Okay. We're going to try to keep our heel on the ground. Feet are a little bit wider, about hip width apart. Okay. You don't want to be in a tightrope. Okay. Feet are about hip width apart. You're going to gently just lean into your front knee, keeping your heel on the ground. That's important. We're going to do 10 reps here. So count with me as we're going. So this is 9. So what I'm doing is I'm trying to keep my heel on the ground, and the stretch I feel should be in the bottom of my calf. So the Achilles tendon, tends to be where we get really tight, probably from some hip instability. Let's do 4 more. Okay, and I want you to try to relax the front of your ankle as much as possible. If you get a little wobble in there, it's okay. Again, we're calibrating, we're finding our balance. This is our last one here. Feel this stretch. Now you should feel with your heel on the ground, this stretch is feeling like it's lower in my calf. Okay, we're going to step in front of our platform. balance, right? Find it. That's why we did the foot treatment first. Now we're going to bend into the front knee. So the stretch you feel on your calf will actually be in the higher part of your calf. If you need to adjust your footing, I would suggest pulling your foot closer to you. That's going to give you more range of motion in the front leg. Okay. We're going to bend slightly. Just test it first a couple times. And notice, can you stay in a straight line here, or do you feel like you need to tip your torso to tell you that you're bending? You're not really bending. You actually want to bend your front knee, staying up nice and tall, and just finding a lean. It might be 2 inches. It might be 3 inches. It might be less than that. Okay, we're about halfway. Now, if your back knee is completely locked, stop. Adjust your stance, get a slight bend in the knee, and then move again. We don't want to lock out our knee. We don't want to cause more strain around the front line of our leg when we're trying to work the back line. Okay, let's do one more. Hold it here. Really try to reach your back heel towards the ground without activating the front of your ankle. From here, I want you to try to bend your back knee 10 times. Okay, it's going to be tiny. 1, 2, stay upright. 3. If you can't do this, if your knees and your ankles say no, that's fine. That's what your body's saying. We're halfway. Okay, 3 more here, and then we're going to hold it. All right, we're going to hold, really reach that ankle towards the ground. Sorry, your back heel towards the ground. And then gently stand all the way up. Come off. Shake out that leg. What do we got? Feels like a tree trunk going right into the ground, doesn't it? Feels like you've activated this whole line here. You feel this leg and you're way more connected to awareness-wise how this leg feels, right? All the sensory receptors are woken up, our muscles are activated. Let's switch and do our other foot, our other calf. So remember, ball of the foot needs to be supported. I don't want us to be gripping anything here. I want us to just relax the ball of our foot over whatever surface we're using, about hip width apart stance. Okay, and then we're going to start bending into the front leg. Notice that that stretch starts to get at the lower part of the calf. Okay, so bending into the front knee. Remember, we're not tipping. We're keeping our hips and our shoulders and our head in a line. And as we do this, what does the front of your shin want to do? Does it want to grip? Does it feel like you want to actually pull your foot up because that's supposedly helping? It's not. Okay, so if that's what you're doing, again, reset, pause, shake it out, and then start over. Okay, we're going to do 4 more here. You might have one leg that feels easier to move than the other. Totally normal. Pause here. Feel that stretch. Reach the front heel towards the ground. Just the heel, not the front of the foot. Don't pull the foot up. I want you to reach the heel down. Find your balance. Step over or in front. Now we're going to be stretching the upper part of our calf, okay? Remember, don't lock your back knee. Find a stance that's comfortable for you. Actually, do a couple reps first and see what that feels like as far as the stretch. Okay, and once you feel like you can get a good stretch into the top of the calf, we're going to do 10 reps. If you're like, Adrian, I don't feel this. Well, your back heel might be coming up. You might not have the range of motion. It's fine. You're going to have to keep working on this until you feel like you're getting the right stretch. My left leg definitely has a different structure because when I do this, it's more challenging to stretch the top of my calf. And I know it's because of the anatomy of my ankle and my hip. Okay, let's do 4 more. Don't hyperextend the back knee. And this last one, we're going to pause here. Okay, pause in this stretch. See if you can really notice it reaching at the top of your calf. And now we're going to try to bend the back knee 10 times, keeping the heel on the ground. 1, 2, 3. If you feel like your heel wants to lift, adjust your stance. Okay, 4 more. 2 and 1. Hold it there and then come off. Let's move our platform out of the way. Okay, if you felt like there's any pinch in either of the front ankles, again, this is working on stretching all the structures and the muscles around it. So in time, it'll happen, I promise. Okay, let's stand here. We'll just notice what you feel. Feet side by side. This is how we started our assessment. I actually feel like both legs are activated in terms of muscles all the way around. I feel way more connected to my lower body. If you close your eyes for a second, okay, and scan from your ankles to your knees to your hips, what do you notice? Do you sense them about equally? Do you feel like you're having one that's more in your awareness than the other? That's fine. It's just information. And then also, if you were in your head at the beginning of this assessment, when I asked you how aware are you of your lower body, how does it feel now? Do you feel like you have a better sense as what's going on from the waist down, right? Whereas before we might have been thinking about waist up because we're stuck on our head or our shoulder hurts or whatever. Now we have a better awareness of what's going on down below. For the last part of this routine, you're going to choose whichever device you would like to use, whether it's vibration or percussion, and we're going to kind of take it all home now. So we did some active mobilization of the joints of our feet and getting the fluid to move through our fascia. We did some active stretching, which moved and stretched the muscles of our calves. And now we're going to support that by doing a fluid rinse as well as releasing any other tight muscles that we didn't address directly with the first two treatments that we did. So I'm going to use the rapid release for now. You're welcome to use the fascia hydrator. You can even use the fascia hydrator after the rapid release or your Theragun or your Hypervolt, whatever you'd like to use. So what we're going to do is the inside of the leg followed by the quads, followed by the outside of our legs. So with my rapid release, the setting is up to you. But I'm going to go on a little bit of a higher setting. So I'm going to go right on the inside part of my shin. Whatever edge you like to use, we're going to do 10 swipes from knee to ankle. You can go back up the same way. And again, however you sit is up to you. I chose to sit on my stool because I have flexible hips and sometimes people can't do the things that I do and I take that for granted. So I think most people can get into a position like this. Even if your knee's up a little bit, that's fine. I know that was more than 10, but we're going to continue. So now I'm going to go from knee to groin 10 times. So now we're working the adductor line. This has a lot to do with our balance. It has a lot to do with our pelvic floor. So this whole medial line that I'm working here, very important to counter the strength of the outside of our legs, right? Where you hear people who have tight IT bands or their glutes are tight. Okay, I'm going to say that's probably 10. Now we're going to go along the quadricep here. So from hip to knee, 10 times back and forth. And you'll notice too, if you have hip instability, check out what your quad tendon feels like just above the knee. Oftentimes when there is some hip rotation or just a little bit of how the hips sit differently, if you look at and you feel how tight the quad tendon is, that might be a culprit. I'm finding that it is a lot. Okay, the outside of the leg might be a little tricky sitting, but we're going to go for it. So same thing, outside of the leg, heel to knee. I'm going to put my foot flat 10 times. So these muscles out here are responsible for helping our foot evert, which means the outside of our foot comes up. A lot of times, if we have the feet that like to turn inward, these muscles along the outside of our calves get stuck in a lengthened position, which makes it hard to straighten our feet out. So we want to relax these muscles, not just relax them, but also remind them that they have a job to do and help them get back to neutral, whatever your neutral looks like for you. Now let's do the outside, from the outside of our knee to the outside of our hip. This is our IT band. It can be very sensitive, so be gentle here, especially if you're using a Theragun. I find vibration to be more gentle in this circumstance, but whatever your resources are that you have, it's up to you. Okay? You can spend a little bit more time here if you'd like. For the sake of moving on, I'm going to go to the other leg. So, crossing my ankle over my knee. Again, I'm going to go inside of the shin 10 times. Knee to ankle. You can go a little bit further if you'd like. You can go below the ankle bone. You can go all the way to the bottom of the foot. It's up to you. But we're working the same fascial line regardless. It's along the medial side of the leg that helps with our balance and helps with our pelvic floor. Now let's go from knee to groin. Could be very sensitive in here. There's a lot of lymph nodes that collect fluid here, so this is really good if you're using something like the fascia hydrator, moving fluid from between the tissues into the deeper nodes up to our pelvis and up and out and blah, blah, blah. The lymph system is fascinating. All right, now let's go from knee to hip. I'm going to put my foot down, knee to hip, 10 times, finding your rhythm, noticing what's the status of your quad tendon right above your knee. Is it sensitive? Does it feel dull? Do you not really notice? So those are just kind of things to pay attention to the more you work and the more you maybe do this routine. And now I'm going to go the outside of my shin. So ankle to knee, knee to ankle, however you want to say it. You might find that one side is more sensitive than the other. You might find that one might evert better than the other. I'm definitely struggling with whatever direction I'm trying to do. And then let's finish it going the outside of our legs. So IT band, outside of the knee to outside of the hip. Again, can be quite sensitive, so be mindful of your pressure, be mindful of your speed. You can go a little bit above the IT band and go a little bit below the IT band, whatever works for you. This is rounding out our treatment. And then the last thing I like to do is I like to stand up and I like to address my actual hip bones. There's lots of attachments here. So I'm going to take my device, whatever you're using, find the front of my hip bone. I'm just going to gently put this on the bone itself. So as this vibrates the hip bone, everything that it attaches here is getting some sort of mechanical input. Okay, this helps relax my hip flexors. It helps relax my IT band. Let's go to the other side. Find the hip bone, and then you're just gently traveling your device over the front of the bone itself. I'm not pressing. I'm just moving the device around, letting the device do the work. And let's go ahead and set that down, turn it off, and then let's check in. Okay, so where we started was feet side by side, looking down, your toes are in a nice straight line. Let's shake it out, close your eyes. I feel like that's the icing on the cake, is when we use our device as the last step, it just brings it all home. So maybe right now you feel like one whole complete human, right? Whatever that means to you, but I feel a sense of wholeness. I don't feel so segmented. I don't feel my arms versus my legs, or my feet versus my hands, or my head versus my back. I feel like a whole person, and that I'm very aware of my entire body. Go ahead and just take a breath in, eyes closed or open, doesn't matter. And notice how you feel. So that is my lower body routine. I do that to really become aware of my lower body, and specifically to also stay grounded. Again, with more practice, we gain more fluidity with our movements. We gain range of motion. The architecture of our structure changes, hopefully in a way that's better for us, to help us have more ease of motion, movement, mobility, and stability. So I hope you enjoyed this. If you have any questions, comments, let me know.